Quickly, we'll do a short revision on G.I.T pharmacology. The question you have with you are questions around this section. So we have about 30 questions, and many of them have more than one answer. So I'll read the question and I'll also tell you the answer, but probably I will ask for your own answer also, right? So the first question here is that DASH refers to a group of upper GI disorders characterized by varying degrees of erosion of the gut wall. DASH refers to a group of upper GI disorders characterized by varying degrees of erosion of the gut wall. What's your answer? Peptic ulcer disease. That is correct. Now, number 2, peptic ulcer disease develops when aggressive factors like dash 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 outweighs defensive factors like dash 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 dash. So what we need to do is we need to mention the aggressive factors that would trigger PUD. Now, in your aggressive factors, you should have H. pylori,
Yeah.
you should have NSAIDs,
Yes.
you should have acid, that is gastric acid,
Yes.
you should have what? Pepsin. So these are some of the aggressive factors that would trigger.
All of bicycles.
We cannot list all of them. It's not self-exhaustive, but the major ones are the ones I listed. Aggressive factors will include your what? Your H. pylori, NSAIDs, acid, pepsin, etc. Then defensive factors are factors that tend to protect the stomach from what? The ulcer. And what do we have? We should have your mucus, right? Bicarbonate, the bicarbonate itself, prostaglandins, the submucosal blood flow. So these ones would help to counteract the negative effect of the aggressive factors. Question 3 now. Gastric acid is an absolute requirement for ulcer formation. Actually, gastric acid is an absolute requirement for ulcer formation. Without gastric acid, you don't have ulcer forming. So, in the absence of acid, no ulcer will form. True or false? That is true. True. Without gastric acid, no ulcer will form. Number 4, the two most common causes of PUD are dash and dash. Okay.
There's a reason I want to counteract this your truth. Because you said without gastric acid, no ulcer will be formed. What of in the sense of the organism?
H. pylori, right?
Yeah.
And that is what people tend to say. What we are saying is that what most people that have ulcer have an infection with H. pylori. Most people that have ulcer, about 90% of them, either gastric or duodenal ulcer, have also an H. pylori infection. So the point is, if you do not cure the H. pylori, right, the Helicobacter pylori, you don't get rid of that, the ulcer will not heal up permanently. You will have relapse. It's a very high incidence of relapse. So, but the point is, the acid is the primary cause of the ulcer. Okay. So now, beside the two most common causes of PUD are dash and dash. That would be what? What do we have? We have H. pylori and NSAIDs. H. pylori. So to what she said, right? H. pylori, NSAIDs now, we know most persons because of the use of NSAIDs, they have ulcer. Then once a person gets this infection, and because of the continuous production of acid, the person will have ulcer. Number 5, what are the goals? What are the goals for treatment of PUD? So when you want to treat PUD, what do you want to achieve? Relieving of symptoms, yes. Prevent the occurrence, yes.
To
Heal the ulcerated tissues, okay.
Decrease the frequency and
okay, so that's correct. So we have said that we have you want to alleviate symptoms, the goals of therapy. You want to alleviate symptoms, you want to promote healing, you want to prevent recurrence and complications like hemorrhage, perforation and obstruction. Number 6, the major drug classes used in treating PED are dash dash and dash. What are major classes? Antibiotics, drug classes, antibiotics or antibacterials, then histamine H2 receptor antagonists and proton pump inhibitors. These are the three major drug classes used. Number 7, question 7. Because non-antibiotic therapies do not cure ulcers but create conditions conducive to healing, therefore relapse rate with them alone is high and much lower with the addition of antibiotic therapy. True or false?
True.
That's true. It's a statement of fact that what if you treat ulcer without antibacterials, what you do is you create conditions for healing. You may get some healing, but there will always be relapse. There will be a case of relapse. Number 8, patients with H. pylori infected gastric or duodenal ulcers. See how it's put here. Patients with H. pylori infected gastric or duodenal ulcers must receive which class of drugs alongside others? Huh? If you're treating ulcer, you will give the major drug classes.
Yes.
Because of this, what you must give must be what the antibacterial antibiotics. That's the right option. You are going to give PPIs, you're going to give other ones, but because there's an infection, a bacterial infection, you treat the bacterial infection with what? Your antibacterial. Number 9, the most commonly used antibiotics for H. pylori are dash. Now you have to mention drugs. Number 9, what do we use?
Azithromycin.
Okay. Amoxicillin, metronidazole, tetracycline, bismuth. You know bismuth from bismuth of salicylate.
Yes.
Bismuth, and then I think somebody also said that they use a lot of erythromycin, but you have your amoxicillin, metronidazole, your tetracycline, your bismuth. That's that. Number 10 now. A minimum of 2 antibiotics are used to prevent dash and increase that. Why do we usually give more than 1 antibiotics? To prevent resistance and to increase what? Efficacy. So that's straightforward. Now, number 11, the mechanism of action of cimetidine and other H2 receptor antagonists is what? What is the MOA for cimetidine?
Histamine H2
Okay.
Acid.
Yes, they suppress acid secretion of acid by blocking histamine H2 receptors on parietal cells of the stomach. That's correct. Number 12, why is cimetidine different and less desirable than other histamine H2 receptor antagonists? What is the problem, or what are those things that stand out with this what do I call it, cimetidine?
Anti-androgenic effect.
The potency, adverse effect,
Yeah.
interaction.
Two major ones: anti-androgenic effects, which may cause infertility in men,
Yes.
and the fact that there is a lot of drug interaction because they inhibit an hepatic enzyme that will metabolize other drugs from that class. Okay. Number 13 now. Proton pump inhibitor mechanism of action is what? What is the mechanism of action of proton pump inhibitors?
It inhibits gastric pump. Stomach.
It inhibits gastric acid pump, hydrogen, potassium, ATPase. So the enzyme, which is the enzyme that makes gastric acid. That's the enzyme that makes gastric acid. So proton pump inhibits that. Number 14 now. Dash are the most effective inhibitors of acid secretion. Which drug class? PPIs. Proton pump inhibitors are the most effective inhibitors of acid secretion. Number 15. Dash can increase the risk of fractures, pneumonia, hypomagnesia, and cause acid rebound when treatment stops. So the option we have H2 receptor antagonists, PPIs, and prostaglandin. PPIs, yes. PPIs will increase risk of fracture, pneumonia, and that. Number 16 now. Dash what promotes ulcer healing by creating a protective barrier against acid and pepsin. Protein agent and the surface of this word. Right? 17 now. Dash is an analog of prostaglandin E used in preventing gastric ulcer by insects. Misoprostol, also known as what? Cyclotec. Okay. 18 now. What stimulates uterine contraction and hence is contracted in pregnancy? Misoprostol is that drug. 19. What class of drugs promote defecation? Laxative will promote defecation. 20. Dash is defined primarily by stool consistency and not by frequency or volume of bowel movement. What is defined as primarily by the stool consistency and not by frequency? Constipation. Constipation is, yeah. I told you. I said constipation is not defined by how many times you go to the toilet or whether you can. I don't use the word because it's fun to use that word. Whether you can remove one drum of fecal matter. So constipation is, you have to be gauged individually, right? And you look at the person's consistency, like that is what you have to do. So not that you do the other way. Number 21 now. Dash, what type of laxative swell in water, soften feces and increase fecal mass, thereby stretching bowel wall? What type of laxative will swell? That means will absorb water,
Bulk
will
forming.
soften feces, increase fecal mass, and stretch the bowel. So stimulating the bowel to bring down feces.
Bulk forming laxative.
That is a bulk forming laxative. Get it? A bulk forming, what is bulk? Add bulk to your feces. Add bulk by soaking water, then the fibers will not digest, then add that to your fecal matter. No, 22 now. What type of laxative must be administered with fluid to avoid esophageal obstruction? Bulk form, because if you do not and the thing gets stuck in your throat, you will suffocate. It will dry up. It's just put up water there. 23 now. Patients taking osmotic laxatives must increase fluid intake to avoid dehydration. True or false? That is true. If you are taking an osmotic laxative, from the word osmosis, you need to take water so that you don't get dehydrated. 24 now. Stimulant laxatives like bisacodyl act on the intestine by doing what? What do they do? Yeah, 24. They stimulate. So they cause irritation that will now promote peristalsis, secretion, and what? Evacuation. So that is what we know about stimulant laxatives like bisacodyl. 25. How do you differentiate between locally acting antidiarrhea from systemic acting antidiarrhea agent? How did we differentiate between them? Locally acting and antidiarrheas. This was in this time when I asked him, what did the person say? Anti-laxative. Were you the one who said Jamila?